So be on the lookout for that. I still don't have a start date. I know they're actively working on it. But I'm happy to be here via Facebook and YouTube and Instagram. So today, what did I have? I thought I would start with something fun because the conversations have been pretty serious. We're still in the thick of this pandemic, and a lot of people are already thinking, oh, things are great, and they want to lighten up the restrictions and the stay home, be safe. And I think there's so much we don't know about this virus. We know it's a pretty dangerous virus, and it's pretty broad symptoms and serious symptoms in many cases, and we actually don't even know who had it. So a lot of people are talking to me like, you know, I was sick in January and it was a very odd thing. Wasn't like the regular flu. I wonder if I had COVID. Well, we won't know until we can all be tested. So so it's just thrown us all for a loop. So I had a joke. What did I do with my joke? Well, I messed up. I mixed up my paperwork, but I will tell you, we'll start off with something thoughtful, and remember that no act of kindness, no matter how small, it's not a small act of kindness. It's an act of kindness. So regardless of how small, it has a ripple effect. It has a ripple effect, and it has a no logical end. So whatever act of kindness you provide, you know, somebody doesn't have enough to pay their grocery bill, you know, and their ATM, their codes aren't working. You say, well, are you short? Are you short? You know, give them $5 or $10 or whatever you can. That has lasting power. I'll tell you my something that's stayed with me for such a long time. My mother had a stroke 9 years ago, and we hadn't gotten her an electric wheelchair, and we were still getting used to getting around. She was well. She was out of the danger zone, and so we were several months into it. And we went to a market, and we were using their scooter, which really is difficult for somebody that only has control over one side of their body. And so she would have to reach, and this is an older woman in her 80s, now in her 90s, she had to reach to use the control to make the scooter run. And there were no handicap spots, so I was kind of double parked and getting her into the scooter. And what she's got now is great. It's a great electric wheelchair, and she has control on the side she needs it, and she can manage the whole operation really, really well. It's like a small Honda. Anyway, but we were using the market, I think it was a Target. We were using their scooter and transferring out of the car. And as much PT and OT as she had, and as much as she knows I've been a nurse for like forever, she has fears, and she wants to be in control. And so she was exiting the car, and I was trying to get the scooter as close as I could, and I couldn't get it terribly close to the car. So we were doing the best we could. We had a few feet we were dealing with. And a young man who was also handicapped, who was wheelchair bound. People are coming and going, and I've had this experience taking her to the bigger stores, the Costco's of the world and the Walmarts of the world, and you know, big shopping malls and so forth. And people are just busy. This is pre-COVID time, and people are just moving back and forth. And literally in a busy Costco, people almost knocked her over, which is just so wrong. People, take a breath, look around, see who needs a little bit more assistance than you. Anyway, and I would just tell her, because she would be sort of impatient, you know, excited to get out and go and shop. And I'd say, Mom, please be careful, because other people may not be careful. And then I would go park in the handicap and then go spend a good amount of time trying to find her. I could always hear her when she backed up on those scooters, because they have an alarm. At any rate, the act of kindness that stays with me and probably makes me pay more attention when I'm out and about people's needs and so forth, is that this very young, severely handicapped, I don't know, I can't tell you what was wrong with him. Maybe it was MS, maybe it was something else. But he, all the people coming and going and crowding around and, you know, pandering for money and whatever. And even some of the employees, because, you know, they have shopping cart attendants out there. Nobody said, do you need a hand? And she's, you know, she needed a hand. She was, you know, and, but I was, of course, there to help her. But he said, he came up very close to the car, very close to where he says, let me give you a hand. How can I help you? And I was just like, thank you. And she was, thank you. And we managed. She didn't need to do anything. But the fact that he wanted to and recognized there was a need was so beautiful. And so we'll start with that because I don't know what happened to the joke. These jokes are for nurses alone too. Oh, I know. It was something about the nurse asking the patient, oh, are you type A? Is your blood type A? And then the patient says, no, it's type B. And then the nurse says, oh, that must be a typo. Okay, that's really bad. But, you know, healthcare people get it. So we're going to talk about today protections that your employees must provide for COVID-19. Now, employers, let's review. Employers do have some responsibilities, and this is information you can find from the CDC, the Center for Disease Control. You can find this information from any of there really aren't a bunch of them. In different states there might be. But the National Nurses Union, the NNU, you can find it from any of the nursing associations, the CNA or SNA, and these are just basic, any law, OSHA, for example, organization for OSHA, it's a government organization. Everybody, it's like the Department of Health, OSHA. What does OSHA stand for? Shoot. Occupational Safety, yeah, and Health Organization, Administration. Okay. OSHA, OSHA, Organization for Safety and Health Administration. There you go. So the basic things that an employer needs to provide for an employee are hazardous assessments. They need to assess the workplace, the whatever products are being used, the beds, everything from the ceiling to the floor. That is theirs to assess for hazards at any given time. So it's a constant thing to maintain your OSHA standards, right? Everybody does it. And then we have other checkpoints like the Joint Commission and so forth. But these are very, very basic. And they exist for many, many employees. But of course, we're very healthcare focused at medical jobs. So, the employers are responsible for hazardous assessment of the workplace. They need to identify and control physical and health hazards. So that would be hazmat, you know, wheelchairs in the hall, anything, you know, that the entire environment is mandatory for employers to keep a safe environment. And this applies to clinics, this applies to hospitals, very much so to hospitals, and skilled facilities and long-term acute facilities, any long-term facility, they all have to provide for their employees. They are all committed to maintaining OSHA standards, okay? So I'm going to use a lot of fours, okay? There's 4 basics, right? Hazard assessment, identifying and providing the proper PPE when it's needed. The PPE is the proper protective equipment, okay? Gosh, I don't know why personal protective equipment. PPE is personal protective equipment. Good grief. Okay, so they have to provide the proper PPE. That's 2. 3 is they need to train their employees in the use and care of PPE. Doesn't matter if you hire a nurse aide that's been a nurse aide for the last 20 years, or a nurse, an RN, who's been a nurse for the last 15 years. It doesn't matter. Training is your business. It's your business, and it's you're the employer. So don't take for granted just because you hired a wonderful, experienced head nurse that she doesn't require training. Everybody requires training, and then actually periodic retraining, which is my number 4. So 1, hazardous assessment of your environment and your materials. 2, proper PPE. 3, training of that proper PPE, training your employees in the use and care of it. And then 4, periodic review of training and your own assessment of your facility. Okay, so those are the 4 top things that OSHA and CDC and the nursing unions all agree on. On the other hand, employees, let's talk to the employees too, because many of us, myself included, have been on both sides of that coin. We have to wear the PPE that they provide for us. Oh yes, you better put your sterile gloves on if you're suctioning, okay? And if you're just doing oral suction, you better do good hand hygiene. So use your PPE that is provided for you by your good employer. Attend the trainings. Oh yes, don't just use it because you know so much about it. Attend the trainings when they're scheduled, okay? And your job too is to take care of the equipment they provide for you. So, so care and maintenance of the PPE, and that also, I'm going to add to that, is the proper disposal of it, right? Don't forget that. And then 4, it's your employee. Nobody can fix something if they don't know it's broken. And if your poor, director, whoever, is stuck in meetings day after day and off-site to conferences, week after week, it's your job to inform the employer via your immediate supervisor, or the next level up, however, whatever it takes, that if there's a need for PPE, if there's a need for repair of the PPE, and if there's a need for replacement. Okay, so so work together, folks. Okay, that's just a prep for what I wanted to talk about today, which is what is the must. What are those 4 musts right now for employers to provide protection for employees, particularly nurses, but not just nurses. I am very concerned about everybody out there helping out during this crisis, and there are a lot of crazy things happening. Doctors are being pulled from their regular jobs and asked to help out in the ER, and nurses that have been retired for a few years are asking to come in and to support in the COVID time right now, and some of them aren't even carrying their basic BLS. So it depends on where you are, how intense the needs are. Like some of the states, New York, parts of California, Washington, are really, really having a hard time. So hang on a sec. So we need to talk about what the employer must provide as protection for workers during COVID-19. And it's not rocket science, but I want to tell you, minimally, they should be providing an N95 respirator or higher. N95 is kind of the standard. It's the one when we test every year for our size, because they have, I really think they only have 2 sizes. I haven't been clinical in a while at that level, so they used to have small and regular, I think. So they must provide an N95 respirator for you or higher. They must provide isolation gowns. They must provide eye protection, and they must provide gloves. So that's the 4 things. 4. In addition to that, for those persons working in the ICUs, ERs, ORs, there's additional equipment that is needed, particularly when they need to be protected from the airborne infectious diseases, which is what the COVID is, what the it's a novel pathogen. They're calling it the novel COVID-19. And so, so there's a whole list of things that require additional equipment when dealing with those type of procedures and are okay, in addition to the 4, more protective PPE, more personal protective equipment will be needed if you're dealing with, I'm going to give you a whole list of procedures, but in that case, you would need a powered air purifier respirator, okay? So that's called a PAPR. And if they don't have that, you may need to talk to the supervisor lickety-split because you need to be protected. And you've seen people on the news, because I know you've looked at the news. Those are different kind of, the N95 is basically a mask, but these things are pretty much headgear, and they look like spacesuits. They look like, if anybody's seen E.T., the kind of equipment that they're wearing. So you really need, it doesn't necessarily include the gown and all that, although you probably are going to use that just because we wear a lot of these things to protect the patient from anything that may be on us, dust particles, or, you know, we've been at the hospital for a couple of hours, we've walked in and out of rooms and so forth. So we're protecting the patient from as much as we can, keeping them safe. Even though we're not sick, we're in an environment of illness. So we wear the gowns and the footies and so forth to protect others, to protect our patients. But this PAPR, the powered air purifier respirator, is a very specialized mask, and you would use it for some of the following, okay? I'm going to say minimally for these. I may be leaving some out, but I did go to a couple of sites and gathered all this. So any intubation, endotracheal intubation, BiPAP and CPAP, you know what those are if you're a respiratory therapist, and if you work in acute area or ever have or did the training, BiPAP and CPAP. Airway suction, that could be oral, nasal, through the tubes, through the trach and so forth, so airway suction. High frequency oscillatory ventilation. Basically, that's the bag valve mask that may be used during CPR. So of course you need protection during that. Tracheostomies, chest physiotherapy, right? We're doing chest physio because we want to break up the things that are affecting their lungs that are making them so sick. Well, then they may be coughing and sputtering, and oh well, you're exposed. You need a really good protection from that. Chest physio. Nebulizer treatments. Again, you're treating the lungs, right? Nebulizer treatments and therapies. Sputum induction. Anything that you're giving the patient. Mucinex would be an over-the-counter type, right? Guaifenesin. You may be giving things intravenously, different things to bronchodilate, and so all those treatments that initiate sputum induction with your patients. Bronchoscopies. Now that's the only time I recall, well, not just bronchoscopies, a few procedures I've done where I've worn all that gear and worn the PAPR. PAPR, powered air purifying respirators. Yep. What did I say? Bronchoscopies, yes. Tracheostomies, that's another intubation that if you're in an acute setting, that you may be part of that team providing that. Open thoracotomies, getting into the chest. Okay, this is a disease that has a lot of involvement with the lungs, and any other upper airway endoscopies, bronchoscopies, we call them bronchs, intubations, endotracheal intubations, tracheal intubations, all of these things, okay? So the 4 things that the hospital must provide for you we'll go back, is the N95 respirator masks. If they have something higher than that, go for it. That's fine. Isolation gowns, eye protection, and gloves. So a lot of the hospitals are protecting with all of those things, and goggles. Now, they may ask you, and you know, we have to be patient with our employers as well, because the need for this is so intense and is affecting so many people so quickly in a short amount of time. I'm talking to you in April, and we really only got wind of this in March. Excuse me. So be patient with your employers too. Don't let them off the hook. It is their job to not put you in harm's way and to keep you alive and well. But be patient with them. So my friend, who I mention all the time, she is a respiratory therapist, and they didn't have enough N95 masks, or they anticipated not having enough. So they asked their team members to take them home. They provided a bunch of brown paper bags, and take them home and air them out and put them in the sun and bring them back, because the mask is only effective until it gets damp. So it has to dry out and air out. But wouldn't that, I mean, work with that. It's not like they don't want to get them, but every hospital in the nation is trying to get them. And not just the acute hospitals, the subacute hospitals, the long-term acute hospitals, the nursing facilities, the skilled facilities, the rehabs. Everybody needed them all at once. So there was a period there where it was no fun for her, and she was working very, very hard, which she does anyway. She works in ICU and ER all over the hospital, NICU, and treatments, doing the nebulizer treatments. So she had to work with them. It wasn't any fun, but she did. And then not only did they run out of masks, the N95s, they ran out of the brown paper bags. So not fun. She's healthy. She's just had enough vacation that she could isolate herself for 2 weeks, and on day 17 got to see her grandchild. So that's the silver lining. But it's tough out there, and I wish I had better jokes than type A, type B, and type O blood. But yeah, there's certain things employees must do for their employees, and then the employee is responsible on the other part of working with it. Your employer has gone through all the time and effort and cost of keeping the workplace hazard-free, and training you and offering training and reviewing training and replacing equipment. So it's your job to work with them, to be patient, to make sure you get to those trainings, to encourage your colleagues to do the same, and to take care of it, to take care of what you can. You know, some of it is reusable. I mean, the N95 technically isn't meant to be reused like that, but it can be, and it needed to be. So, yeah. Gloves, no. The gloves, when you're done with the gloves, because they're germy things. And yeah, that's kind of what I wanted to cover today. And to say protection is important, and we've been practiced in this since Florence Nightingale. You know, the hand washing, and you go home and you take your uniform off and wash it in hot water. And in some hospitals you can change there. In a lot of places where I worked pre-op and post-op and OR and so forth, you just came in your own clothes. And in California, we'd come in our shorts and flip-flops. That's not usually my style, but that's okay, because you were going to put on clean scrubs every time, and headgear, and get your mask and know where the gloves were and do your hand washing. So a lot of these practices are things we've always done. There's a high awareness in healthcare workers about protecting bloodborne pathogens, airborne pathogens, aerosol, all of these diseases where we've been aware of, this is a new one, okay, and a pretty bad one. And once we know more about it, we can put it in the same slot we put, cold sores and, well, maybe not exactly the same spot. Well, we've been dealing with the flu, and we've been dealing with pneumonia, and we've been dealing with tuberculosis, and we've been dealing with AIDS, and we've been dealing with a lot of terrible diseases that hurt a lot of people and kill some people. And it's our job, and we're knowledgeable, and it's not always easy, but we will, when we know more, I think everybody will be a lot more comfortable. In the meantime, we have to learn more, and we have to work with what we have. So that's what I wanted to talk about. Got to be protected, and we both have to do our employers and our employees, we have to do our best, right? The employers have huge responsibilities, and then the employees have huge responsibilities. They're providing the safe environment and the safe, the protective equipment and the training and so forth. So it's our job to reciprocate by using that equipment, appreciating the employer, taking care of that equipment, attending our training. Those are the symbiotic relationship that that provides the best we can bring to the table for our patients, right? That's what it's all about. That's why we do what we do, right? And remember to be kind, because it is a wonderful ripple effect that has like no logical end. It could just go on and on. Take care, everybody. I'll talk to you soon.